Okay, this video is intended to learn a little bit about the patient tools that are available to anyone who enrolls in the RUNX1 Patient Data Hub through the Matrix system. Again, these tools are features that are beyond the surveys that we're asking specifically about your RUNX1 FPD related experiences. You can find them down on the left. I'm going to highlight a little bit about health info, symptoms and activities, insights, journal, and sharing center. So to start, I just want to mention under health info that there is another video to show you how to set up any connections you'd like to make to your electronic health records. And that's a nice feature because you can bring in anything that you feel is important to track all in one place from any clinics or hospitals that you are a part of. And uh, when you do so, you can choose to populate these other sections: medicine supplements, conditions, treatments, etc. But one other thing you can do is actually manually enter things like medicines and supplements. And these four listed here are things that I've entered manually myself. And you'll know that because it doesn't show a symbol, this symbol next to it here. Um, you can add additional medicines and supplements, and a nice thing is that this is populated with common medicines and supplements in the back end. So perhaps you're taking Claritin. I know I've written Zyrtec there, but I suppose you're taking Claritin as well, or instead sometimes. And so you can select these standard strengths and enter the dosage: 1 tablet, frequency daily. Do not take on the same days as Zyrtec. I'm not sure that's true, but I would think so. And click save. And so that's added to your list. Suppose I was adding Claritin because I've stopped taking Zyrtec. I can indicate that I'm stopping the Zyrtec entry. And so you can see that it has become inactive there. It's listed as historical, but it's inactive. All right, so I think I'll leave that there, other than to say with the EHR connections, once you connect and you indicate what you want to be brought into the system, once per week, the matrix system goes out to check those connections and see if there's any new data. So perhaps across the year when you have your flu shot, or any other vaccines, those will be automatically populated into this section of the data hub for you. So that's a nice feature. And then I want to show you some symptoms, the symptoms and activity section as well. I think this is a really nice opportunity to begin to track some issues that have been bothering you and you want to kind of think about and monitor. And one of those things that we might see among our community are heavy periods and related issues that women often have. And so I've listed a few here, and I've actually, if I go back in time, you'll see that I've marked these ones indicate the days that these things have been experienced. I can create a new symptom, perhaps eczema is something that I deal with. That adds a row here, and I can indicate that, today, sure, right now I'm experiencing eczema, maybe on my hands and neck. And then I can say from on a 0 to 10 scale, I'll call it about a 7. And I'd say that worsened since the last time I had a flare up. So I'll select worsened. And so that appears, oh, I see it didn't populate here because we are back on December 8th through 14th. But if I go to the current week, you'll see that pop up here on Tuesday. And one thing I want to note is that when I added it, this default time is actually my current time. Because I'm going to exit that and not save it, because when I set up my account as Amanda Egg and the patient, I did go into my settings and make sure my time zone was central where I live. I'm going to go to edit and select your time zone. And please note that the default here, when there are new surveys or other study notifications, the email is the default, so you'll receive an email to the email address you registered with. You'll also receive an email when you have a message from us. There is a messaging center within the system that's really nice for us to communicate with patients in a secure and private manner about the patient data hub. You can turn on text messages as well for these, and a text will go to the phone number that you provided, but I'm going to turn those off since it's not really a phone number. And I'll leave it as email and click save. All right, let me jump back over to symptoms and activities. From symptoms and activities, I want to highlight the insights feature, which is really one of my favorites. And this is a chance for anyone in the system to sort of act like their own little scientist to try to figure out if they can see any parallels between some of their activities and their choices in diet and medications, etc. So I've popped to insights, and this is the chart. This is the last chart that I developed. And if you want to change up the chart, you go to filters and you'll see that symptoms, activities are listed here, and those are the ones that you just saw me tracking, as well as medicines and supplements. And so we can include up to 6 of these items in one chart. So I've selected 5 out of 6. I think I'll add Pilates to this and apply. And now you see Pilates was added to the bottom. So today is about here. And if you scroll backwards, you can see that in the past, oops, no, I just recently started tracking. So back in November, I started tracking some Pilates exercises. I'm going to double click to zoom in. And so in early mid-December, I had cramping, headaches, or heavy periods and backaches at the same time. I did start Pilates in hopes that would help, but it didn't seem to really make a difference then. Around December 21st, I continued the Pilates, but I began an anti-inflammatory diet and kept track of the days that I was able to follow that. And you might see here that then my next period came along, still was heavy, but I only had 1 day of cramping and no backaches. So as sort of a novice scientist here, I might say, maybe this anti-inflammatory diet is helping me. Um, we can't make draw clear conclusions from this, but maybe it'd be worth talking to the RUNX1 team and telling them what I'm seeing, and perhaps seeing if they have any scientists who have been thinking about this, interested in exploring this. Maybe there's a study in the works for this. Maybe we could follow up with a survey through the system asking people about their diet, alongside women their experience with periods, or for everyone their experience with some other types of flare-ups that they have with their health. And so this could spark additional studies or lab studies around diet and well-being. So this is a really nice feature of this. And of course, you're not expected to share this with us, but this could be something that we'd love to hear about. Okay, so that's the Insights tab. The Journal tab is really just sort of your own place to track thoughts and um, anything that you want to track. I started tracking, notes on eczema from a recent visit. I can click save. All right, so my journal was updated. I can create another category, perhaps. Here it will be like mental well-being notes. I could say anxiety tracking or anxiety notes. I could say that yesterday, had experienced much anxiety around an upcoming presentation for my at work. Um, meditation helped calm me, as did preparing demo videos to show the day of the event. Click save. And those notes come here. So this is really just sort of like a sticky note tracking, and you can use this as you wish. Let's see. So that was the journal, and I'm going to go down into the sharing center. So the sharing center is a place where you can securely and privately share information from the data hub with anyone, your doctors, nurses you work with, um, the teachers at your child's school. And so there are a couple different ways you can do this. You can print out these shareable items, or you can create a link, which is really such a snazzy feature, I think. So I'm going to call it um, teacher introduction. So perhaps, or you know what? Yeah, I'll call it teacher introduction, teacher slash school nurse introduction. So perhaps my child is starting school soon and I want to introduce the concept of RUNX1 and what they experience. I'm going to say it doesn't expire. It's never going to expire. In that situation, I just give them one link. And as I update the system in the areas that I share with them, and they can click on the link in perpetuity and find that any updates to these sections. You can always go delete these later. So if that makes you uncomfortable, or you could say, I'm going to my child's about to graduate from elementary school, so I'm just going to use 1 year as the expiration time. Let's see. So you can choose medicines and supplements to share, which is a common one with schools, conditions. Oops, oh, right, we have no conditions here yet. I know that in here we have some symptoms. I have some general information about myself and my family in there. And then I want to share my genetic test reports. I don't think anybody would want to share them with their teachers, but suppose you had other kinds of documents in here, perhaps like the RUNX1 fact sheet you could even include in here, or like an emergency form that a nurse would want to have, knowing sort of maybe what medications your child is taking and sort of how to react to a severity in a fall and a bruise, that sort of thing. So you can actually select any of those documents that have been uploaded. You can share, a physician with the teacher as well, only including the current ones I'm seeing, or only include emergency contacts, and save. Okay, so here is the entry that was created under the sharing center. In order to share that with the teacher and school nurse, you'll want to get the actual web address to copy. And to get that, you click on the link, and that'll actually open up that very specific address that you'll share. But you'll also need to share a passcode. That's what offers that security. So if you click on passcode view, the passcode for this one is 5025. And so when the teacher receives that link, they enter 5025, enter, and it says, please remember you're viewing personal health information and be careful. And this is what it looks like to them. And that sort of thing. Oh, you know what? Yep, we can scroll down through this section, scroll down through this section. So this, I think, is a really nice feature. You can print it, or the teacher can print it and save it into their files on their side, and that's what that looks like there. Okay, I'm going to close out that section, and I think that concludes